Hello, good morning, everybody. Okay, we'll continue with the yesterday's class because we have seen yesterday. So we'll continue with the yesterday's class. As I was talking about the introduction to brain and also to the neuroanatomy, you can see the yesterday's uh, power slides of the PowerPoint of this class. So we have seen about the brain, how it was divided into three parts: forebrain, midbrain, hindbrain. I also spoke about how there was an evolution of the brain, if you remember in the yesterday's class, okay, regarding how there were first the formation of network in the salient traits, then the formation of the ganglion, okay. Uh, then we have also seen how there was a tubular nervous system developed in the higher organisms. We have seen that in the tubular system, the spinal cord was there. We have classified as central nervous system and the peripheral nervous system. In the central nervous system, the brain and the spinal cord, brain and its structures. Then in the peripheral nervous system, we talked about the autonomic nervous system, and then the spinal nerves and the cranial nerves will be coming under the autonomic nervous system. Okay. Now we have brain proper in the sense the cerebral hemisphere. If you see the brain proper, we have classified it as again as three parts. That is the forebrain, midbrain, and hindbrain. We talked about how it was again. You can see in this picture how the tubular nervous system was developing three vesicles, large vesicles, and we call it as forebrain vesicle, midbrain, and hindbrain vesicle. These vesicles were again subdivided into, if you see the forebrain, it was divided into telencephalon and diencephalon, where we had the cerebral cortex derived from telencephalon and the thalamus and its structures from the diencephalon. There was mesencephalon was not classified or divided into two, but rather it developed into midbrain solely. Whereas the hindbrain, you have seen that it is developed into metencephalon and also the myelencephalon. The metencephalon gave rise to cerebellum and the pons, and the myelencephalon gave rise to the medulla oblongata. Okay, so this was regarding the development of the brain and the classification of the brain. Okay, how different structures are derived from the different parts of the brain. So we call it as the forebrain was also called as the prosencephalon, midbrain was also called as mesencephalon, and hindbrain was called as the rhombencephalon. Okay. I think I have also shown you this diagram from the Gray's Anatomy, where primitive structures, how they were developed. You can see that the nose was developed from the forebrain, eye was developed from the midbrain, and the ears were developed from the hindbrain. Okay. Yeah, we were talking about the spinal cord yesterday. I told you when you take the brain and the spinal cord is more primitive because it shows segments. Okay, and it is tubular. If you remember, during the talk regarding the evolution, I was talking that how the organisms developed from unicellular to multicellular, invertebrates to vertebrates, those organisms having brain, not having brain, to development of the brain. This is one thing. So vertebrae, in the vertebrae, if you see the spinal cord developed, Okay. Now, we only learned yesterday about the external features of the spinal cord. I think everybody knows this, and just I'm recapitulating. Okay, we have seen. I told you how you can identify the spinal cord, the gross structure as anterior and posterior. I told you it is a cylindrical structure. If you see, antero-posteriorly flattened, in the sense the posterior part is flat, whereas anteriorly it is convex in nature. That is how you identify. I also that the spinal cord will occupy the vertebral canal. If you remember, in the dissection, we were removed the spinal cord. The spinal cord did not occupy the whole of the vertebral canal. Why? Because the vertebral canal has grown within years, but the spinal cord after certain time the growth stops. That is the reason it is occupying the upper two-thirds of the vertebral canal. Okay. Now we already know what are the functions of the spinal cord. It is going to receive all the sensations. You know all the modalities of the sensations, if you see from the spinal cord, are received through the dorsal root of the spinal nerve. And it is also called as the Bell-Magendis law. We'll see in the coming slides. Okay. Now, what is the function of the spinal cord? It is going to integrate, associate, and then produce a response. That is the function of the spinal cord. Now, what is the extent? Now, if you see the extent of the spinal cord, it is having an upper end and a lower end. The upper end is extending from the just posterior or lower part of the foramen magnum, or if you draw an imaginary line from above the first pair of the cervical nerves, that will form the upper end. What is the lower extent? The lower extent is nothing but, if you see, it is having a cylindrical structure with a tapering end, which we are calling it as conus medullaris, and it is extending from up to L1. So I request all the students to maintain the decorum of the class. Please do not interrupt my PowerPoint. If you have any problem, you can leave the class. Okay, right. So there were two enlargements. You can, obviously, the enlargements are for the accommodating the more number of neurons. We are having the cervical enlargement. We are also having the lumbosacral enlargement. Okay, the cervical enlargement is extending from C, and whereas the lumbosacral enlargement is extending from L2 to S3. Okay, so that part of the spinal cord which is giving rise to a pair of spinal nerves will be called as spinal segment, or it is also called as cord segment. So this is a primitive feature you have seen in the annelids, like the earthworm, segmental arrangement. So each segment will be supplied by that particular pair of spinal nerves. That is called as the segmentalization. So here, what is the spinal segment or cord segment? That part of the spinal cord which is giving rise to a pair of spinal nerves is called as the spinal segment. Now in this picture yesterday we have seen about the cervical enlargement and the lumbar enlargement. Okay. Yeah. Now you are able to see the coverings of the brain. The coverings of the brain is also called as the meninges. Okay. We are having dura mater, arachnoid mater, and pia mater. The dura mater is developed from the pachymeninx, whereas the arachnoid and pia mater is developed from the leptomeninges. The dura mater, if you see, it has a extending from the foramen magnum to S2 vertebra only. So it is having only meningeal layer. Outside that dura mater, there is a space which we are calling it as the epidural space. What does the epidural space consist of? It has the fat, loose areolar tissue, and internal venous plexus. The subdural space is filled with the capillary fluid. What do you mean by subdural space? The subdural space is nothing but the space between the dura mater and the arachnoid mater. So it is not having much importance, but there is a capillary. Now you are able to see in this picture how there is a dura mater, arachnoid mater, and pia mater. Outside the dura mater, we have called it as the epidural space. Now the arachnoid mater. This also is extending from foramen magnum to S2. the space between the inside the arachnoid matter after L1, where the spinal cord ends, it is called as the spinal cistern, and it is present the between the L1 and S2. It is called as spinal cistern, where you will be having a lot of CSF. Okay. See, we are taking special classes, online classes for the benefit of the students. I know that a lot of people are having a problem with conducting classes. Again, I'm asking everyone to refrain from doing such acts, because it will be a problem later on if we know who is doing what. Okay. I'm telling you very politely to stop making that nonsense things. Okay. Right. Let's come back to the class. Now, if you see the pyometer, there were four modifications of the pyometer. One is the phylum terminale, okay, which is also non-filamentous thread. It is extending from L1 to S2. It is having a length about 20 centimeters, okay. The second one, if you see in this picture, you are able to see from conus medullaris. Yeah, sorry, there's a problem with my audio over here. Now, can you hear me, Vidya? Is my voice audible? Okay. Uh, right. So we were talking about the modifications of the pyometer. Okay. Okay. So you are able to see the phylum terminal, one of the modification of the pyometer. It is extending from L1 to S2, non-filamentous thread. The second modification we have seen linea splendens, which is present in the anterior median fissure. It is continued with the phylum terminal. The third and most important was ligamentum denticulatum. There were coronally oriented 21 pairs of pial sheets, which are helpful in anchoring the spinal cord. And if you see the first one, there's an importance. It is attached to the foramen magnum. In front, we are having the vertebral artery. Behind, we are having the axillary nerve. One is extending between the T12 and L1 nerves. So this is very frequently asked, ligamentum denticulatum. So this is very important, okay? The fourth one is a subarachnoid septum. It is a mid-sagittal sheet extending from arachnoid to the dorsal surface of the spinal cord. It is present along the posterior median sulcus. So today one of the student was asking whether where we have to do the lumbar puncture in children. I am not sure, but I will try to get the answer of it. Whereas in the adults coming back, it is done between L3 and L4, okay, where there will be no damage to the spinal cord, and in the spinal system there is a lot of CSF. So for analyzing the CSF, we can aspirate it, the CSF by puncture the lumbar, by giving lumbar puncture. We can also give anesthesia in the epidural space for the painless childbirth. Okay, so this is the picture you have seen yesterday. Cauda equina is one important question which will be frequently asked. Okay, what does it mean? The last four lumbar and sacral and coccygeal nerves together will be seen like a horse tail. So it is called as the cauda equina. Okay. Next. So today's class, if you see, I will try to be very brief and I'm not going to go into much details, but you are able to see that when you take a cross section of the spinal cord, you will be able to see a butterfly shaped structure in the center and the white structure at the periphery. Now you know this is called as the gray matter. This is called as the white matter. Okay, the gray matter is having, whenever we talked about the gray matter, it means yeah, I'm sorry. So if you see the gray matter, it is having the neurons supporting tissue as well as blood vessels. Now, if you see this white matter, they are nothing but the axons or the nerve fibers along with the supporting tissue and the blood vessels. Okay. Now you are able to see this is called as the anterior horn or anterior bulb. This is called as the posterior horn. And it is also having an intermediate region, and this is called the gray commissure. If you take two symmetrical halves, you are having same on either side. You are having the anterior horn, you are having the posterior horn, intermediate region, okay? And these two regions are connected by a transverse commissure. And in the center, you are able to see a space, it is called as central canal, where the CSF will be continued into the ventricle, okay? Below, if you see, the central canal will be continued into the filum terminale, and it ends by what is called as terminal ventricle. The name is given as. Now, coming back, if you see, the anterior horn is more broad and the posterior horn is more slender, okay? You are also able to see the two halves are separated by a deep cleft here. It is called as anterior median fissure, and this is called as posterior median septum. There's a septum over here, okay? This part, we are having a small nick here, anterolateral sulcus, and we can call this as posterolateral sulcus, which divides the white matter in each half as anterior funiculus, lateral funiculus, and also this is the posterior funiculus. For description purpose, they say that anterior and lateral together will be called as anterolateral funiculus, okay? And posterior funiculus is taken as separate entity. Sometimes postero-intermediate septum also will be present over here, which divides the posterior funiculus into a medial part and a lateral part. This becomes the medial, this becomes the lateral part, okay? Now, so what are the things we are going to learn in our class in this cross-section of the spinal cord, where you are able to see you are able to see we have called matter, we divided into as the anterior horn and also the posterior horn, intermediate region, and also this is a transverse commissure. Okay, now We can also call these as the anterior columns. Okay, these will be called as the columns, anterior column, posterior column. The reason we are calling these as horns and columns, I will just try to tell you the small difference. Now, if you see in this picture, the gray matter is almost seen like a horn. If you see a cow horn or bull horn, it is looking like a horn. That's why it is called as the horn. Okay. Now, if you see in this picture, actually, when you see in the spinal cord, when you uh, see, the gray matter is continued from top to bottom and is present as a column. That is why it is called as the column, anterior column, posterior column, and the intermediate column. You are able to see how the gray matter in this picture is seen as a separate column from the white matter. Okay, so that is why the two terms are relevant, both the column and the horn. Are you able to understand? Just a minute, because I'm having a trouble. My just laptop got hung up. Yeah. Now, regarding gray matter, I told you the grayness is due to the cell bodies. There's an accumulation of the neurons at one place along with the neuroglia. Neuroglia is nothing but the supporting tissue which is present along with the nerve fibers and also with the blood vessel. Now, when you come to the white matter is nothing but the axons of all the nerve fibers as they are forming fiber-like structures, and this whiteness is due to the presence of the myelin present around the axon. So this whiteness is due to the myelination of the nerve fibers, and it is occupying the peripheral part. Remember, whenever I yesterday also I mentioned this word, the presence of gray matter in the center and the white matter at the periphery is a primitive feature. When you go at a higher level, suppose if you see in the brain, I have used the word yesterday specifically corticalization. That means what happens, the certain nerve cells have outgrown themselves and they are occupying the nerve fibers, they are wrapping up. That's why when you see in the cerebral cortex, what happens, the gray matter is at the periphery whereas the white matter is in the center. That is a feature of the advanced organisms here. Okay, so spinal cord is showing the primitive features. Now if you see, as we have mentioned, that all the nerve fibers will be calling these as funiculus. Okay, yeah. Anis, you have raised the difference between the horn and the column. Again, I'm telling you, see, when you take a cross section of a spinal cord, they are seen as a horn. If you see, just a minute, dear. Now, if you see this picture over here, okay, if you see here this picture, you will be able to see the horn-like structures here, okay, when you see this cross section. I am asking the students not to interrupt my class in the PowerPoint, please, okay, refrain from doing this. And if you have any problem or whatsoever, you don't like listening to class, you may leave the class, I don't mind, okay. Now see in this picture, okay. See, this is looking like a horn. When you just take a one cross section, here it is seen as horns. That's why I'm using the word anterior horn and posterior horn. Okay, but when you see the as a whole anterior gray column from starting from the spinal cord, from the magnum to the L1 vertebrae, it is a continuous structure. That is why we will be calling it as column, anterior gray column and posterior gray column. Okay, sometimes the lateral horn or lateral columns are also present. Okay, we'll see in the coming slides. Now we were talking about the white matter, anterior, lateral and posterior. They are arranged as three bundles or three nerve fibers arranged in three different types of bundles peripheral to the gray matter. So that is what we'll be calling it as the variations in cross sections. Now, if you see, there are three regions: cervical region, thoracic region, and lumbosacral region. If you see here, in the cervical region, ventral horn is large and white matter is abundant. If you see, when you just go to the higher levels, what happens is the white matter is very less. Ventral and dorsal slender, lateral horn begin to appear in the thoracic. In the lumbosacral, ventral and dorsal horns are large, white matter is less. Now, you can see in this picture is again taken from the GRACE. You are able to see this is the cervical, third, C3, C6, then T6, then third lumbar. If you see here, the white matter is decreasing as you go to the higher levels, where you are able to see cervical region, the anterior horn is slender. Okay, again you can see the presence of lateral horn in the thoracic region. We didn't get the exact good thoracic level. Now in the third lumbar, you can see the anterior horn is quite very large. In the second sacral also, you are able to see the scanty white matter, more of the neurons coming over here. Okay. Now, I want everybody to listen this part of the class. The blood supply of the spinal cord, very, very important. It has been asked almost every year. One or the other, it is coming. Now, whenever you read about the blood supply of the spinal cord, you have to understand that it is supplied by three arteries or three trunks, we can say. Three trunks: anterior arterial trunk and two posterior arterial trunk. Arterial trunks are given from the branches of certain vessels. Now remember, while we were seeing the sections of the spinal cord, we have seen in the center in front the anterior median fissure, right? Everybody have seen that. In the anterior median fissure, we'll be having anterior spinal trunk, and on each side behind the spinal nerve, you'll be having the posterior spinal trunk. Now, the main artery which is contributing in the formation of the anterior spinal trunk are the branches of the vertebral artery. There are two branches, anterior and posterior spinal branch. The anterior spinal arteries, if you see, there is, yeah. So there are, apart from these branches of the spinal arteries also, you will be able to see that there are other vessels which are forming the anterior arterial trunk. Suppose you are having deep cervical. Deep cervical is a branch of costocervical trunk, again a branch of the subclavian artery, if you remember, second part of the subclavian artery. You are also having ascending cervical. Ascending cervical, if you see, it is given by the inferior thyroid. Inferior thyroid is again a branch of thyrocervical trunk. Thyrocervical trunk is a branch of first part of the subclavian artery. Then you are having intercostal arteries and the lumbar arteries. Now, all these arteries will help in the formation of the arterial trunk. Okay, arterial trunk. Now, if you see here, the anterior spinal artery will pass downwards. Suppose the vertebral artery is there. It is having anterior and posterior. Anterior spinal arteries will pass from each side. Both sides will join to form the anterior arterial trunk, and it is reinforced, or it is being continued. Why it's stuck? Just please hang on. I don't know, my laptop is being hung every time. Now see this picture. If you see, we are able to see the anterior spinal artery, which is given by the two sides of the vertebral artery, anterior spinal artery. This anterior spinal artery is reinforced by the intercostal artery, lumbar artery. It is a continuous one. Okay, it is a continuous. It is forming the anterior spinal trunk. Behind also we are having posterior spinal artery. Sometimes it might be given, or it is contributed by posterior inferior cerebellar arteries also, or posterior spinal artery given by the vertebral artery itself. Now there are two in number. They are slender, and they are being continuous with the deep cervical, intercostal, lumbar. Here we can talk about the ascending cervical also. Okay. Now what you have to understand is that all the arteries will form what is called as the segmental arteries. They will give a branches to each segment, and each segmental arteries, if you see, it is dividing into anterior and posterior radicular arteries. Anterior is among the anterior radicular arteries in the lower part of the thoracic and also the upper lumbar region. One of the radicular arteries given by the segmental arteries is very large. It is called as arteria radicularis magna, or artery of Adam-Quist. Okay, so this is very important. So this artery will give a branch to the anterior arterial trunk, and also small branches to the posterior trunk. It provides nutrition to most of the lower 2/3 of the spinal cord. You have to remember this point. So we were talking one anterior and two posterior arterial trunks. Segmental arteries will reach the spinal segment and are divided into radicular arteries, anterior and posterior, along the roots of the spinal nerve. One of the anterior radicular arteries, especially in the lower thoracic and upper lumbar regions, is very large, and we have called it as artery of Adam-Quist. It supplies lower 2/3 of the spinal cord. Now you have to also understand that here they are forming the plexus. You can see how they are. This is the anterior spinal trunk. This will be the posterior spinal artery. They are forming a crown-like structure. They are called as vasa corona or coronal plexus. Later on, of course, the anterior spinal trunk and posterior spinal trunk or arteries will give you central branches. That means they will pierce the spinal cord and supply the gray matter. You can see in this picture. Okay, so that is about the blood supply. Again, I'm telling you, the blood supply of the spinal cord will be by three main vessels. One is the anterior arterial trunk, then two posterior arterial trunk. Among these, one anterior arterial trunk is present in the anterior median fissure of the spinal cord. This anterior spinal trunk will be given or majorly given by the vertebral artery. Posterior spinal branch can be given by the posterior spinal artery of the vertebral artery, or also the inferior cerebellar artery. Now the spinal trunks are again contributed not only by the vertebral branches, but we are also having deep cervical, ascending cervical, intercostal branches, and also the lumbar branches. They are forming the segmental branches. That means each one will give a branch to each segment. That means pair of spinal nerves. These segmental arteries will divide into again as anterior and posterior radicular arteries. For us, the important is anterior radicular arteries. The anterior radicular arteries in the lower thoracic and upper lumbar region, one of the artery is very large, and it is called as artery of is my voice audible now? PowerPoint is visible now. See, please. So one of the anterior radicular artery is very large, and it is called as the artery of okay. Now you can see this picture also, how there is a anterior spinal artery. One among the radicular artery is very large. We are called it as artery of Adam-Quist. Then there is a posterior spinal artery. Okay, posterior spinal arteries are two in number. And remember that when you take a cross section of the spinal cord, anterior 2/3 of the spinal cord will be supplied by the anterior spinal artery. This anterior spinal artery will supply anterior 2/3 of the cross section of the spinal cord, whereas the posterior 1/3 will be supplied by the posterior spinal artery. Okay. That is about the arterial supply. When I talk about blood supply, we are supposed to talk about not only arterial supply, but also the venous drainage. There are 6 venous channels draining the spinal cord, 6 venous channels. There will be one in the anterior median fissure, one in the posterior median septum, and there will be one in front of the sensory spinal root and behind the one motor root of the spinal nerve. So we are having here 1, 2, 3, 4. Similarly here also 5, 6. Totally there will be 6 longitudinal venous channels which drain the spinal cord. So again, I'm just repeating: anterior spinal vein present in the anterior median fissure, posterior spinal vein in the posterior intermediate septum, 2 longitudinal venous channels on either side behind the motor root of the spinal nerve, and also in front of the sensory root of the spinal nerve. So there are 6 longitudinal venous channels. So as I told you, there will be 6 longitudinal veins, one each on the anterior median fissure and posterior median sulcus, and 2 lateral venous channels. Now coming back to the organization of the spinal cord. Now this is important for us. Now we have seen that there is a gray matter, there is a white matter. Now what exactly is in the gray matter? When we talk about the section of a spinal cord here, I'll just get back to the picture once again. Now, when we talked about the section of the spinal cord here, this is the anterior horn or anterior column. It is having an apex and a base. This is, again, if you see, this is the posterior column or posterior horn. It is having a cap, apex, base, and also one more thing over here. Okay, just a minute. So I'm sorry here. If you see here, it is having a head and a base. Here it is having an apex. Okay, it is having a base and also neck here. So apex, head, neck, and a base. There will be 4 structures here: apex, head, neck, and base in the posterior column. Here you will be having head and base in the anterior column. As I told you earlier also, you are able to visualize that the anterior horn will be more broad and short, whereas the posterior horn is more slender and thin. Okay, then as I also told you, there is an intermediate region. Okay, and this will be called as the gray commissure, whereas anterior funiculars are also connected by the transverse white commissure. There is a bridge, or there is a connection between the fibers. Okay, now coming back. So how does the neurons are arranged? Now when you see in the anterior column, the neurons are arranged in 3 groups. The gray matter, we are talking about the gray matter over here. Now as you see in this picture, this we have called it as the anterior or anterior column. This we have called it as the posterior column. This we have called it as intermediate region. Now, as I told you, the gray matter consists of cell bodies or the group of neurons together with a supporting tissue and as well as the blood supply. Now, for us, more important is the how the neurons are arranged. The neurons are arranged, if you see, we are having here medial group, lateral group. Sometimes there will be a central group also. Sometimes there will be a lateral group also. These are the neurons arranged in groups in the anterior column. Similarly, here also, we are having the posterior column or posterior horn. The neurons are arranged in the intermediate column, or also the neurons are arranged. Now, if you see, the neurons are arranged as columns in 3 groups: medial, lateral, and central. The medial group, if you see, again, they are subdivided into ventromedial and dorsomedial. Now, again, you see this picture. If you see this picture, I can say this as ventromedial, this as dorsomedial. So these 2 group of neurons, we are calling it as the medial group of neurons. This ventromedial, if you see, and dorsomedial, they are all going to supply the muscles of the trunk. you remember yesterday's class, I told you in the phylogeny, the main function of the neurons was to supply the muscles, right? Muscles. One of the evolving feature is that we are having the formation of actin myosin filaments in the cell structure, molecular level. I told you yesterday. For this, so thereby there should be a control over that muscles also. They are being supplied by a particular set of nerves, and these nerves are present in the spinal cord. Remember, this is a primitive feature, and this is very important. We have evolved in a certain way. Okay, so the muscles of the trunk will be supplied by the neurons or the nerve fibers present in the medial part of the anterior gray column of the spinal cord. Okay, similarly, if you see the lateral group neurons are arranged in three. They are going to supply the limbs over here. If you see here, yeah, you can see your yeah, you can see here, yeah, ventrolateral, dorsolateral, retrodorsolateral. There will be three group of neurons here: ventrolateral, dorsolateral, and retrodorsolateral. And these neurons, they are going to supply the muscles of the limb. Okay, supply the muscles of the limb. So that is about. Now in this picture also, you are able to see how they are present in different regions. This is the cervical region, section of the thoracic region, lumbar region, and the sacral region. You are able to see the neurons over here, medial group, lateral group. So in the cervical region, you are able to see the third one, the central group. This medial group, as I told you, they are going to supply the muscles of the limb. The lateral group, they are going to supply the muscles of the upper limb. Now, in the central part, these nuclei are going to, they are present only at the level of C3 and C5. They are going to supply the diaphragm. They are going to supply the diaphragm. And upper five, first cervical to fifth cervical also, there are certain neurons which are going to form the ascending rootlets of the axillary nerve. They are present only until the fifth cervical nerve. Okay. Later on, they will be absent. Now, when you come to the thoracic part, you are able to see only the medial group also here. You are able to see the medial group. Similarly, here also, lumbar region. You are able to see medial group and the lateral group. This lateral group now is going to supply the muscles of the lower limb. Okay. Now you are able to see here the sacral group. So it continues. This is how the neurons are arranged. Now, yeah, the same thing is overwritten here. Only in cervical part, you will be seeing the central group, which supplies the diaphragm, phrenic nucleus. Sometimes the spinal nucleus are also present in C1 to C5. Now, the posterior gray column. Here, as I told you, there are four parts of the posterior gray column. We talked about the apex, then we talked about the head, neck, and a base. Now, they are given different types of names also. Substantia gelatinosa, nucleus proprius, nucleus dorsalis, and visceral afferent nucleus. Now, substantia gelatinosa will be lying all along the length of the spinal cord. It will be later on continuous with the fifth cranial nerve in the higher levels. And this is the one actually, if you see here, yeah, you are able to see again in this picture, substantia gelatinosa, nucleus proprius. Here you are having the nucleus dorsalis, and you are also supposed to have this one more group of neurons, whereas this visceral afferent nucleus. Okay. So in that picture, it was not seen. Okay, substantia gelatinosa, if you see, it is going to receive the pain pathway, pain and temperature from the sensory root of the spinal nerve, the whole of the spinal cord. Okay, nucleus, it lies deep to it. It is also receiving the same sensations. Nucleus dorsalis, it is extending from C8 to L2, and they are receiving the proprioceptive and exteroceptive sensations from the trunk and the position and the okay, nucleus dorsalis. Now there is a third one, intermediate. Region is also having the nuclei. Now if you see over here, intermediate, medial and lateral, where are they? Yeah, lateral group and a medial group. They are divided into lateral and medial group, and they are concerned, or they are for the sympathetic system, thoracolumbar outflow. We have talked about the vegetative system, that is nothing but the autonomic nervous system, which we had the sympathetic part, sympathetic and parasympathetic. If you remember the sympathetic, we were talking yesterday, is a primitive features. Okay. Now, apart from the columnar arrangement of the neurons, we are also having the laminar concept. Rex was one scientist who has again took further a step forward and created this laminar concept. Now, if you see here, we are having lamina 1 to 6. Substantia gelatinosa nucleus proprius was given the lamina 1, 2, 3, 4, 5, 6 over here. Now, again, if you see the seventh is the intermediate region where we are having the group of cells, we call it as Clark's column, and also for the sympathetic system. Eighth is the medial part. Okay, where is this? Yeah, eighth you are able to see over. And this is all the ninth, and this is the 10th in the commissure. So zone around the central canal. This is a laminae. So, okay, that's about the gray matter. Now, when you come to the white matter, you know that they are having the fibers of the neurons or the axons together as the bundles of nerve fibers. There are 5 types of nerve fibers present in the white matter. One coming from the sensory root of the spinal nerve, a group of fibers going from the spinal cord to the higher centers to the brainstem and the cerebral cortex. There are fibers which are coming from the higher centers to the spinal cord, that is from the cerebral cortex to the brainstem. That's why whenever we talk about the type of neurons, coming back to the gray matter, again, I'm talking about the gray matter here, the neurons. We talked as upper motor neurons and lower motor neurons. This word we have heard it earlier. Upper motor neurons are those nerve cells which are present in the cerebral cortex, brainstem. Lower motor neurons are those nerve cells present in the spinal cord. Are you able to understand? That is the basic difference. Now, apart from the ascending and descending fibers also, we are also having what is called as intersegmental fibers. Now, I was telling you that apart from the neurons, there will be a supporting tissues. If you see in the gray matter, just give a pause to the white matter, coming back to gray matter, you will be also able to see the interneurons. Interneurons means they are present between the sensory and motor neurons. Suppose we are talking that anterior gray column is having a motor neurons, whereas the sensory neurons are present in the posterior gray column. So suppose from a muscle, a sensation is to the sensory neuron, and the sensory neuron conveys to the motor neuron, and motor will be showing the response to the particular muscle. That's fine. The action is predictable. Now, suppose if there is an intervention of the interneuron, suppose there is a sensations carried from a particular muscle or organ to the sensory neuron present in the posterior gray column. Similarly, there is an intervention of interneuron. So the sensory neuron will not directly convey to the motor, rather it will convey first to the interneuron. The interneuron will convey to the motor neuron, and then there will be the action response. So here the reaction is unpredictable. It might be excitatory, it might be inhibitory. Suppose, for example, if you say Renshaw cell is a classical example of inhibitory interneuron. We have used the word interneuron, present between two neurons. So interneurons are present between types of neurons. So that is what I just wanted to say, these things. Okay, so there will be intersegmental fibers, vascular propria as an example. Of course, we are also having the ventral roots of spinal nerve. The nerve fiber, the neurons present in the anterior gray column will convey the motor ones. They will also have the roots coming from the spinal nerve. So these types of nerve fibers are all present in the white matter. That's the arrangement we'll be having. So anterior nucleus, if you see, we'll be having from peripheral to deep or from superficial to deep, you'll be having the descending fibers outside, ascending fibers in between, and deep fibers. They will be mixed in both. Now in the lateral nucleus, if you see, we will be having ascending at the periphery, descending in the middle, and both in the center. Okay, now this is a, so all modalities, whatever the modalities of sensations has to be conveyed to the spinal cord, they will be coming through the sensory root of the spinal nerve, and this is called as the Bell-Megendie. Might have learned in your physiology. Okay, in the posterior funiculi, sorry, I also just bypassed this one. Posterior funiculi, whatever the fibers are there, they are purely ascending fibers. Okay, they are completely sensory. That's why we are calling it as ascending fibers. They are going to the higher centers. Okay. Now, I'm not going into the deep of this whatever the tracts. I'm just going to give you a name, and then I will give you a very brief because I have a limited time over here. Okay, so you are able to see on your screen that there are two types of tracks: ascending and descending. The name itself is suggesting something here. Descending means they are coming from the different parts of the brainstem and all, and ascending means they are going from the spinal cord to the different parts of the brain. Are you able to understand? Now you have to, yeah, I think I will just name them and I will just conclude my class. So we are having descending tract. If you see, we are having from cortex to spinal cord, corticospinal, rubrospinal, red nucleus, vestibular apparatus of the cerebellum, vestibulospinal, reticulospinal. Then we are having tectospinal, olivospinal. This, when you read about the brainstem structures, you will find the certain parts in the brainstem. So thereby they are given that name. Suppose rubro, red nucleus of the midbrain. So rubrospinal. Similarly, here also ascending from spinal cord to thalamus, spinothalamic tract. From spinal cord to olivary nucleus, spino-olivary. From spinal cord to cerebellum, spinocerebellar tract, dorsal lateral tract of leisure, near the apex of the posterior gray column, when the sensory neuron will receive what is called as dorsolateral tract of leisure. Now, posterior funiculus, as I told you, it is purely sensory. Ascending tracts will be there. Those fibers together will be called as fasciculus gracilis and also the fasciculus cuneatus. Okay, they end near in the medulla oblongata. Okay, at the so respectively. Now, this picture is taken from the grace where you are able to see both the ascending and descending tracts. Okay. So if you see, we'll talk about the ascending tracts first. First and foremost important will be the spinothalamic tracts. You know that 3 order neurons will be present in the ascending tracts. They'll go directly into the higher centers. Rather, there will be 3 order of the neurons. So this might be the 2nd order of the neurons or might be the 1st order of the neurons. Now, if you see the spinothalamic tract, they are present throughout the spinal cord. They are classified as lateral spinothalamic tract and anterior spinothalamic tract. They are crossed. That means the fibers here, whatever the tract, actually what you see, they are coming from the opposite direction. And these are 2nd order neurons of the substantia gelatinosa and nucleus proprius. That means when a sensory nerve root is coming from a particular muscle, if you think that as 1st order, from there, the posterior gray column, where we are having substantia gelatinosa and nucleus proprius. From there, we will be taking these nerve fibers will again ascend. We are calling this as 2nd order of neurons. These will be relayed again into the thalamus. From thalamus, 3rd order of the neurons will start. So there are 3 orders. So lateral spinothalamic tract will convey pain and temperature, whereas the anterior spinothalamic tract will convey this touch and pressure. Okay. I don't know how far I can show you these diagrams. Now you can see this picture to a certain extent, the anterior spinal. 1st order neurons are coming and relaying into posterior gray column. The 2nd order, they are crossed, whatever we are talking about, the spinothalamic tract. So they are crossed. Now they are forming the 2nd order of the neurons and they are relayed into the thalamus. This is the 2nd order. Now, from the thalamus, they are again relayed. These from thalamus, 3rd order of neurons will start and they are relayed into the cerebral cortex. There are 3 order of the neurons. There are exceptions for everything. In this context, as we go on, we'll see in the later part. So, thalamic tract, spinothalamic tract, they convey pain and temperature as well as the touch and pressure. Now, cerebellar tracts, they are also touch and pressure and posture and movement of the lower limb. That is the difference. So, if you see, there is a small difference. The anterior, if you see, they are crossed. Posterior, they are uncrossed. Ipsilateral fibers and contralateral fibers. The spinocerebellar tracts, okay, they extend all along the spinal cord. The posterior spinal cord will receive from the Clark's column the fibers, okay, and they ascend on the same side, okay. Whereas the anterior spinocerebellar tract, they are being crossed. Actually, they are coming from the opposite side, and that's why we are calling it as contralateral fibers. Okay. Now there is a tract gall and tract of Broda. The gracilis will be called as tract of gall. They are again conveying the fibers from the lower extremity and lower thoracic. They are also second order neurons. Whereas fasciculus cuneatus, if you see, they are carrying the fibers of the upper extremity. Since the upper limb is present at the higher level, they extend from C6 at a higher level, okay? And they almost end near in the nucleus in the medulla oblongata. From there, they end in the sensory cortex. So later on, you will be also hearing the word lemniscus also, decussation. Crisscrossing of the fibers will be called as decussation, okay? So from the tip of the posterior column, dorsal tract of Leisure, they convey pain and temperature. They are actually the first order neurons. Spinotectal tract, spinovisual reflexes of the spinal cord. Okay, there also he says some books that it is forming the alternate route for the pain pathway. Corticospinal tract. This is very important. Whatever you read in the physiology, the descending tracts, among all the tracts, important is the corticospinal tract. Since the fibers are passing through the pyramid part of the medulla oblongata, they are also called as the pyramidal tracts. Okay, these tracts are called pyramidal tracts. The rest of the tracts will be called as extrapyramidal tracts. Okay, they are arising from the areas 4, 6, and 312 of the cerebral cortex. And when they descend down near the medulla oblongata, they crisscross. That is called as decussation. 90% will cross and form the lateral corticospinal tract, and a few fibers will remain uncrossed, and they will be forming the anterior corticospinal tract. Okay, these are fibers which are responsible for the volitional movements. They control the voluntary and discrete movements of the limb muscles. Okay. I think I'm exceeding my time. Okay, I will end my class, and if there is anything, I'll come back later on. Okay.